My name is Danielle Devine. I am a registered nurse and a full-time faculty here at Drexel University, and I am happy to be here. The current state of nursing and what it's been over the last couple of years has been a little tricky for some. We have had a large rate of nurses leaving the profession. It has been a hard time retaining nurses. And for right now, the biggest question for me is why not us? Why not now? So joining the nursing profession, trying to be a catalyst for change, to go out there, to change the script, to be a positive presence at the bedside is one of the biggest things that I think is so important in healthcare. And nurses are at the forefront, and we need to bring them back there at the bedside. So while it still may be a difficult time for nurses, I can't think of a more suitable profession to say I am up for the challenge and get me out there. So I think there's no better time than now to be a nurse. Drexel has a wonderful nursing program. I have taught at a couple different teaching institutions, and I have been here at Drexel the longest, and I plan on staying here for a while. And one of the biggest reasons why is the investment that the faculty put into their students. I can tell you that I treat my students not just as students, but I can tell that they are people, and they are a brother, a sister, a boyfriend, a girlfriend, a child, a whomever, and so you really, while we want them to treat patients holistically, you get a holistic approach with your faculty as well, where they see you as a full person. And what you get in the hospital and in simulation and through just being here in the city, I think really provides a well-rounded environment for the student. The value of a Drexel education is something that I take so close to heart. I'm so proud to be a faculty here at Drexel. I know so many students say the same thing when they go out there. One of the things for Drexel is that our name speaks volumes. I know a lot of nurses at a lot of different institutions, and one of the things they always say is if I see a Drexel student on the floor doing clinical, I try to grab them right away and have them come with me. We have students who are known to be eager. They are hungry to learn. They are also hungry to learn more. And I think always wanting to learn more and have a passion for questioning things is what really speaks about Drexel and their pursuit for continued knowledge, even when they're not a student and they're an alumni here of Drexel as well. Faculty here at CNHP is something that I greatly pride myself in, and me myself being a faculty as well. You have faculty who, again, want to see students not just as students, but as a person. I think seeing a student that they bring multifaceted issues to the classroom really helps to kind of create that whole well-rounded nurse as well. And one of the things that you're really going to get from faculty are people who are staying current with evidence-based practice, what's going on with healthcare legislation, the current healthcare climate, and nurses that are still working at the bedside as well. So many of us not only work here at Drexel, but usually do a per diem gig at some place as well, where we're really keeping our feet wet. So why should someone choose Drexel Nursing? My question would be, why not Drexel? I love everything that our program offers. I love the pace of our program, whether it be the co-op experience or whether it be the ACE program. You are getting a very explicit experience that other universities do not offer, whether it be if you are co-op and you are getting to orient to different hospitals and getting experience outside of being here in the educational setting, or whether you're on that accelerated track and you are that student who is bringing experience from their previous life and from their previous degree and now bringing it full circle. We really get to encapsulate the different facets of nurses because of the different experiences that they are bringing here. I absolutely love the dynamic of the students that we get into the classroom. One of the things that I pride myself in as a faculty is having a very informal class. I think that learning should be interesting. I don't think it should just be me standing up there reading in front of a PowerPoint. And so one of the expectations that I always have of my students is come ready to learn, come ready to participate and give to the conversation. And so one of my favorite things about the students are that they are ready for that challenge. They come eager to learn. They come with so many questions. They really add to the discussion. And what I love about the students, it actually pushes me to be a better faculty because they ask the questions that I'm not necessarily always thinking about. One of the big things is trying to teach a student, especially depending on the program that they're in, if it is an accelerated student, teaching them time management skills is one of the hardest things to do and something that we really try to start in Q1 because being on a 10-quarter or a 10-week schedule right now is an adjustment for a lot of students. So teaching them how to conquer what a 10-week schedule feels like is something that we definitely try to orient them to early in the quarter, and teaching healthy study habits as well. One of the things that we greatly see with a lot of nursing students, whether it's the accelerated program or the co-op program, is that sometimes students have a hard time giving time to themselves. They feel guilty allocating time to sitting and reading a book, watching TV, doing things like that. So one of the biggest things that I really try to teach students is, while it is so important to set aside time to study, to figure out the time management, to not forget the person that you are and to take time for yourself as well. And I think by doing that, we're treating both the student as a student and as a person. And then on that flip side, I get to learn who the student is by saying, what can we do to set aside time for you as yourself? CNHP students are practice ready because they have so much hands-on experience between what they do in the clinical setting and the ample opportunities that they actually have here in our simulation center as well. And one of the things that you're going to see, whether it's at clinical or whether it's at sim, we're really throwing them a lot of scenarios within the classroom as well. So we're really trying to bring experiential learning where they're doing hands-on experiences and trying to bring that on within the classroom as well. So we're really trying to create more tactile scenarios in that class to help them see things that they may not be seeing at clinical right away, or maybe that sim hasn't offered them the opportunity as well. And you also have faculty who are very integrated at the bedside still, and so they're able to bring firsthand knowledge into the classroom too. How Drexel is different than other nursing institutions, I think one of the biggest things is our co-op program and being able to get experience out there on the floor and working at the bedside while not necessarily having educational classes simultaneously happening. It really allows the student to concentrate on what it means to be a nurse, the presence and the impact that it has at the bedside, and how they function within a team setting as well is huge. And they get to embrace that within that co-op program. And I think what the ACE program really allows and stands out amongst other institutions is that it develops fortitude in students. It's tough, our program. It's rigorous. And when you come out on the other side successful, I think students gain a set of confidence that they've never had before. And I think it says a lot about themselves and creates a stronger nurse out there because they know they can do anything. Our students are more than ready to pass the NCLEX on that first time. So the NCLEX has been changing over the last couple of years with the formation of NGN-like questions. And so one of the biggest things that we've been doing with our NGN-style questions to prepare for that NCLEX is incorporating them as a teaching style within the classroom, and we're incorporating them within each objective type of quiz or test that they are getting. And so as they actually matriculate through the program, we are increasing the amount of NGN or NCLEX-like questions in each exam. And so what we're really seeing are that students are prepared for this NCLEX and the different type of style of questions that NCLEX has started to exhibit. It's something that we're greatly priding ourselves in, and we're doing it really well. A lot of our Drexel students are ready to advance at the bedside and are ready to take on a leadership role within the clinical setting, because as soon as they start clinical here, they are either talking to a patient at the bedside, whether it's in the lab, they are getting the introduction on how to talk to a patient, where to begin. And as we move through each quarter, what we're constantly challenging our students to do is to take on more patients, do more roles as that nurse, and our clinical faculty really help to support that. So by the time they hit quarter 4, by the time that they're getting ready to actually go out there and be a nurse and work independently, they have a skill set that's been developed over time that we've greatly built upon. And one of the biggest things that we're really incorporating to that is that when you are at clinical, not just taking a 1-person assignment, but a 2 to 3 patient assignment, to where time management skills, learning how to chart, learning how to give meds to multiple patients, doing multiple assessments are something that they are more assimilated with by the time that they do graduate. So I've had so many experiences with students, but there is one experience that I greatly reflect upon where you could tell a student was having an aha moment, that this meant something to them, that they were in the right track, that they were in the right program of being a nurse. And one of the experience, and it almost humbles me as well as a nurse and as a professor, is that I was urging my one student. She was actually having a difficult time thinking if this was the profession for her. And so we were in quarter 2, and I told her to, why don't we journal what it's like when we go through a clinical experience? So you do your 6-hour, 8-hour clinical, you go out there, journal what it feels like when you come home, sit back and look at those little moments. But don't read about your journal until the end of the quarter. And after 10 weeks goes by, I want you to read through your journal and see if there's any personal reflection, personal growth that has culminated over those 10 weeks. And so she comes running to my office. This is now actually 2 quarters later. So she had continued journaling in quarter 2 and quarter 3. And so she actually didn't look at her journal and towards the end of the 2nd quarter. So 20 weeks has gone by. And when she looked at this journal, she said her first entry said, I knocked on a patient's door and I walked in. And when she's now at the end of quarter 3, where she's like, I don't even think twice about knocking on a door, that I just go in. But the conversation that unfolded from something as little as knocking on a door and saying, "Hi, I'm going to be your nurse," to the transition as what she's made over the last 2 quarters, she felt so much growth and she felt like she was in the right place. But there was something in her notation of, "I knocked on a door," that for some reason resonated greatly with her. And I think as nurses, we will always have that first step, no matter. I've been a nurse for almost 20 years. And despite me being a nurse for 20 years, I always have to knock on the door first. And it's something that never leaves us. And I think it was something that somehow caught her off guard. That's something that was very simple, felt very arduous and hard at one point. And now it's something she doesn't think twice about, and she walks right into that room. And something like that, for some reason, really solidified and made her feel like she's doing the right thing. Something that was once so hard has now become a little bit easier. She was really missing self-reflection. She couldn't figure out if this was it because it's such a difficult program at times, so you sometimes question, why am I doing this, And I think for her, when she was like, I used to have trouble knocking on a door. Like that used to be me. That's not me anymore. And I think it really solidified. I think sometimes we have to be our own hype person, and we have to talk ourselves up a little bit in a profession where everyone looks like they know so much. We forget that we were once all novices and that we were starting somewhere. And I think it was a great reflective moment for her. So one of the greatest benefits about being here at Drexel and having a lot of clinical sites being in a more urban type of setting, right? You get to see so many different types of communities and you get to meet so many different types of backgrounds. I can tell you, working in the city, I work as a nurse in the city, you get to see so many different types of cultures and you really get to see a dynamic that maybe you're not used to seeing in your own lifestyle. And so what you really get to see are sometimes people at their most rawest form in a place where you may not have been able to imagine pain or a situation coming from, and you get to help see people through that. Sometimes you don't get the closure that you need, and maybe it doesn't have the most positive benefit, but you take stories away that will impact, because at some point, someone's going to walk through the doors with a similar situation like that. And working in Center City or working in University City, working in the city, you really get to see so many different cultures, so many different backgrounds, so many different socioeconomic statuses, religions, how people identify, and you see it really come full circle. And so there is not a one-size-fits-all type of way that we treat patients. And it really teaches you to be as universal with how you take care of an individual and as open-minded as you can, so you can see them for all the facets that they do bring.